We have a 37-year-old pregnant woman for a booking in. Have you interpreted for one of those before?
Oh yes, many times.
Good. So you know we'll ask lots of questions about this and previous pregnancies, medical history and so on?
Before the interview, healthcare workers should brief the interpreter about the case and the aim of the session.
Shao Na, is that correct?
No, Wang Shao Na.
Wang Shao Na.
Correct.
Thank you.
In some settings, such as the antenatal clinic, it is advisable to try and match the gender of the interpreter to the client.
Wang Shao Na. Hello, I'm Catherine, your midwife.
你好，我是 Catherine， 您的助产士。Hello, I'm Annie, Mandarin interpreter. 你好，我是 Annie， 普通话传译员。
Mrs. Wang, we'd like to initially see you by yourself, and then later we'll invite your husband.
王夫人，我想让您自己先进来，然后我们会邀请您的丈夫进来的。
为什么我不能进去啊？我今天特别请假来这里啊。
Why can't I come in? I already took a day of work for this appointment.
I'm sorry, Mr. Wang. It's hospital policy. We'll call you in a few minutes.
很抱歉，王先生，这是医院的规定。几分钟之后我们会叫您进来的。
这是什么烂规定
？That's stupid.
Okay. Mrs. Wang, this way, please.
那王夫人这边请。
During the interview, introduce yourself and the interpreter to the patient. Sit facing the patient and speak directly to them. Maintain eye contact and give non-verbal reassurance.
Shana, I'm going to ask you some general questions. Are you married?
邵娜，我要问您一些一般性的问题。您结婚了吗？
是的，那个在前台的怪人就是我老公。
Yes, that grumpy man in reception is my husband.
Shana, how are you feeling today?
邵娜，您今天感觉怎么样呢？
我每天都吐很多，几乎吃不下，甚至连闻到食物的味道都让我觉得不舒服。
请直接跟助产士交流。I've asked her to speak directly to you.
From my perspective, eye contact is a really important part of communication. Health professionals and patients need to have good eye contact to build rapport. At the same time, I need to observe their body language in order to pick up the signals when one person has finished speaking and the other one is waiting to respond. By observing body language, I can check for understanding. And I can constantly monitor the conversation, making sure there's no misunderstanding due to different cultural backgrounds.
You're suffering from morning sickness. It's very common in the first few months of pregnancy. It means the baby's developing well.
During the interview, pause frequently so the information is in manageable chunks. Avoid jargon. Check for understanding by asking the patient to repeat information in their own words.
Shauna, is this your first pregnancy?
邵娜，这是您第一次怀孕吗？
是的，是第一次。
Interpreters should encourage clients to address each other directly. They interpret in the first person, arrange seating to aid direct communication between clients, and encourage clients to look at each other, not the interpreter.
Shauna, within the last year, have you been hit, slapped, or hurt in any way by your partner?
您的伴侣有没有打过您？扇过您耳光或者伤害过您？
没有。
No.
Are you frightened of your partner?
您害怕您的伴侣吗？
不会啊，他可能还会怕我呢。
No, he might be frightened of me.
Are you safe to go home when you leave here?
您从这离开回家安全吗？
是的。
Yes.
Okay, Shauna, we can ask your husband in now.
好了，邵娜，我们现在可以叫您的丈夫进来了。我去叫他。
他们问了你很多秘密是吧？
They've been asking you a lot of secret questions, have they?
Thank you for your patience, Miss Duane. But we might move on now, as we have a lot to get through.
那非常感谢您的耐心，王先生。那我们继续吧，因为还有很多问题要问呢。
The doctor at your next appointment will look at the results of your ultrasound, but you'll need to have another ultrasound at 18 weeks.
点什么头啊？就好像你听得懂似的。
He just asked, "Why are you nodding?" As if you can understand.
I see.
下一次预约
Interpreters usually interpret in the short consecutive mode. They should interpret everything accurately, including side conversations.
At the next ultrasound, measurements will be taken, which will show whether it's a boy or a girl.
下一次的超声波会做所有的测量，并且能够显现出您怀的是男孩还是女孩。
I think that communication flows best when doctors and patients speak naturally, talking to each other directly while being aware of the interpreter's presence. I can then use the natural pauses in speech to cut in and interpret in short consecutive segments. This way, the patient's body language is closely aligned with what they are saying, and the health professional gets a better understanding of the patient.
Well, that's all the questions I have for you. Do you have any questions for me?
那这就是我所要问的所有的问题了。你们还有什么问题要问吗？
我还有一个问题。
I have one question.
我不知道是不是孩子他爸，我可以要求做一个亲子鉴定吗？
I'm not sure I'm the father of the child. So can I have a test for paternity?
I'm sorry, Mr. Wang. That's not something we deal with here. You'll need to go to the genetics department for that information.
那不好意思，王先生，这不是我们能够解决的领域。
Thanks, Annie. That went really well.
After the interview, it is useful for the healthcare providers to ask the interpreter to clarify any questions arising from the interview.
Was there anything I could have missed in the interview? Any cultural things?
It also gives the interpreter a chance to debrief.